Hello, everyone. It is 4:02, so I want to be respectful of everyone's time. So we're going to go ahead and get started. Before I hand things over to Dr. Phoenix, if you have any questions, please type it into the chat. And myself and my colleague Jessica will be monitoring the chat and make sure that Dr. Phoenix and team answer questions. So Dr. Phoenix, over to you.
Good afternoon. I'm Dr. Janet Phoenix. I'm a senior consultant with the Grant Group. I'm very happy to be with you this afternoon to conduct the training session. I'm here with a colleague. We'll be doing the training together. Sydney, would you like to introduce yourself?
Good afternoon, everybody. I'm excited to share this information with you, and we hope it's helpful as we step into this new phase. Thank you.
Thank you. So the title of this afternoon's training is Infection Control Post-COVID-19 Vaccination. And I think we're probably all grateful to be where we are now as opposed to where we were 6 months ago because vaccines are widely available and many of us have taken advantage of the opportunity to become vaccinated. But I think this is a more complicated time than we anticipated, in part because we're no longer all in the same boat, if you will. So some are vaccinated, some are not, some are awaiting vaccination, some are partially vaccinated but not fully vaccinated. So it becomes a much more complex situation to manage for those of us who are working to support people with intellectual and developmental disabilities in group homes and also in day settings. So this training was put together with that in mind to provide some guidance, some recommendations for you as you move forward for how you can balance this situation where we have some vaccinated but some not, but we still have to behave in such a way that we can be protective of everyone. First slide, please. So we will be covering a number of topics in today's training. We're going to talk about the possibility of reinfection. We're going to talk about some recommendations for the process of moving forward as more and more people in the group home settings become vaccinated. We're going to talk about the possibility of booster shots and how to factor that into the equation and provide you with some resources in terms of access to the Montgomery County site and also the Maryland Department of Health site, where there's useful information that will allow you to monitor what's going on in the broader environment in terms of being able to stay abreast of the positivity rates and infection rates in the county and in the state, because that's really the information that will lead you to make some good decisions about moving forward. And then we'll close out with a discussion of travel and transport recommendations, and we'll have plenty of time at the end of the presentation for questions and answers. I would encourage you to put your questions and answers into the chat, and we'll make sure that we cover that information at the end. I think you may have skipped a slide, Sydney.
Annoying because I keep following up and asking.
I don't see the slide with the collaborative graphic on it. And I don't see the slide with the information about the Delta variant.
Okay, this is the one that I received.
Okay, well, we'll just move forward. So I think part of the concern that we have is a concern about the new variant, which is coming out of the outbreak in India. And this is part of what's complicating the recommendations for moving forward, is that we don't really know what new variants may emerge. So for those of us who are fully vaccinated, we're pretty protected against the original strain of COVID-19, against the variants that emerged from the UK, and other parts of the world, but there is this new variant, and there's some indication that the current vaccines are not as effective against the new variant as they are against some of the other strains. So that means that there is a possibility of reinfection. Now, the possibility of reinfection either with the original strain or even with some of the new strains that are emerging is low, but it could increase over time. So the longer we get along the continuum in terms of moving away from the vaccination time, there is a possibility that the risk of reinfection could grow. But right now, this is still a very rare event. So I think that we are pretty comfortable that reinfection rates are low, but we still have to behave in such a way, especially if transmission rates increase in the community. If you receive information either from the state or from the county that infection rates are moving up, again, the reason may be due to some of the new variants that are coming down the road. Next slide, please. So is reinfection possible? Yes. Is it rare right now? Absolutely yes. Should we still behave in such a way that we can be as protective as possible and ward off the possibility of reinfection? Yes, we should. Next slide, please. So if you should become reinfected, again, it would be important to implement these safeguards, to isolate, and especially if you are symptomatic, to wait a period of time before coming back to work. Next slide, please. And we are recommending, it is being recommended by the Centers for Disease Control and Prevention that retesting take place before returning to work for people who test positive. Next slide, please. So here is a website that we are making available to you. And this website is a place where you can report reinfection, and this will be helpful to do as part of the ongoing effort to really record reinfections and try to track cases and to determine what circumstances might lead to reinfection. Next slide, please. So I mentioned earlier that it would be important to continue to monitor what's going on in the community around you. Now, when we did a run through of this training session last week, and we had pulled some numbers in terms of what the positivity rate, which is averaged over 14 days, what that was, and then again, we pulled data again just before this presentation. And what we found is that the numbers seem to be going down very, the numbers are decreasing day by day. So this is the good news, that the rate of infection in the community around us is continuing to go down. This is very, very likely to be as a result of rising rates of vaccination in the general population. I think this becomes a benchmark that you can use for making decisions in the home about what needs to happen and what the requirements and protocols are that you're going to put in place in the group home. You have to put it into a context in terms of what's going on in the community around you. Next slide, please. So again, it's not just Montgomery County and the state of Maryland that you want to monitor, but also the surrounding jurisdictions, so the District of Columbia and also PG County. Next slide, please.
Dr. Phoenix, do you want to update to project the updated slides? Because I think that has the newer data.
Yes, I think what happened is there was a mix-up in the presentation because I had forwarded the updated information with data that we had provided from today. But I don't want to slow the presentation down at this point. I will say that we are going to post the most updated presentation, the slides, as well as the recording on the Primary Care Coalition website. So when you access the recording, you will be able to see the most recent data as of yesterday. I think I pulled the information on June 8th. And so you should have the most recent information as of June 8th in the presentation that will be made available to you in the next couple of days. So most businesses are operating at about 75% capacity. This changes frequently, and we're moving to the point where businesses may be operating at full capacity, but there are still some restrictions in place, and a lot of businesses are making decisions that may be stricter than what's recommended, and particularly in places where people are congregating closely and where ventilation may not be as robust as we would like it to be. Some folks are still operating at limited capacity, and examples of those kinds of facilities would be entertainment places, hair and nail salons, recreational facilities, houses of worship, and also restaurants and bars. But this could change, and many businesses could be operating at full capacity very, very soon. Next slide, please. So again, there are still some restrictions in terms of how many people can gather in these indoor places. Of course, outdoors we consider to be very, very safe. So virtually unlimited if things are taking place outdoors. But for indoor spaces, there are still some restrictions in terms of the number of people who can be allowed in. And in some places, masking is still being recommended. So for those of you who are supporting people who are going out to work or who are going out to day settings, it's important that you be aware of what the restrictions are at the place where the person you support may be working or spending the day conducting some kind of an activity, because it's likely to be different depending upon where you go, and it would be best to be able to prepare the person you're supporting for what the expectations are, so that they can conform to those expectations. Next slide, please. So public transportation is one place where restrictions are really still in place. Face coverings must be worn. So for the shared ride services, the MARC, light rail trains, the subway, face coverings are expected to be worn. Next slide, please. And healthcare facilities are being very careful, extra careful about how people behave in those settings. So clinics, hospitals, healthcare facilities, and to a certain extent, group homes are still considered healthcare settings, and it's appropriate for those settings to observe stricter regulations perhaps than a retail facility. So schools fall into that category as well. You know, the vaccines are now being administered to people at younger and younger ages. But for schools, many of the students attending schools are unvaccinated. And so those settings, clinic settings, school settings, childcare facilities are still places where face coverings are appropriate. And I think the take-home message for this entire presentation is that even though we're approaching higher and higher levels of vaccine coverage, and we may be, you know, getting closer and closer to that magic number in terms of herd immunity, we still have to be careful about the people who are not yet vaccinated or who may never be able to be vaccinated. So there's going to be a small subset of people because of some underlying health condition, some kind of an immunocompromise, for example, that either they're not recommended to take the vaccine, or even if they take the vaccine, it may not function as well for them. They may not build up the same kind of immunity that you and I might. And so we have to behave in such a way that we're protecting them as well. And with this big question mark about the possibility of some change in the virus that could cause a strain to circulate, even in a country like ours, where we have higher rates of vaccination perhaps than almost anywhere else in the world, there's still that possibility that you might be asymptomatically infected with one of these newer strains that the current vaccines don't protect as well against, and that you could transmit that to someone else if you were to interact with them and not take these precautions, such as wearing face coverings. So that's really the underlying concern. I think we're all getting to the point where we're feeling much more comfortable, for those of us who are vaccinated, fully vaccinated, being able to interact with other people who are fully vaccinated and not having to take the precautions that we've had to take in the past year. But the issue is other settings where you know you're interacting with people and there's a subset of the people you're interacting with who have not been vaccinated, and that's the concern. So you have to behave in such a way in that setting that you're being fully protective of them. Next slide, please. So again, for fully vaccinated people who are interacting in an outdoor or an indoor setting with other people who are fully vaccinated, and everyone in the room has had the shot in the arm, you can operate without face coverings. CDC and the state guidance is consistent in this area, that if you know everyone has been vaccinated, you can eliminate the face coverings in casual settings, general settings, home settings. Now, the recommendation for work settings, especially if that work setting is a healthcare setting or a setting where you're interacting with people who are not fully vaccinated, is different. And we'll go into a little more detail about those differences as we move forward in the presentation. Next slide, please. So for the most part, we're moving towards reopening, and we're moving more rapidly towards reopening. And for the most part, a lot of the restrictions are lifting, both at the federal level, the state level, and at the local level. Next slide, please. So in the group home setting, we're going to provide you with some resources that we think will help you to kind of create a very logical set of frameworks and guidance and protocols for yourselves as DSPs, and protocols that management of group homes can use to guide the policies for those who are working in those settings. Next slide, please. So here is an example of something. This is something that was put together and will give you a really easy visual framework that can help you to make recommendations about what activities are safe for people who are fully vaccinated. Almost all of these you can see are safe for people who are fully vaccinated. And then some suggestions for things that you could say to people who are not fully vaccinated. And I think that as we move forward, you know, vaccination is not currently required. And the reason it's not required is because most of the vaccines are still operating under emergency use authorization. Now, this is likely to change within the next few months, and we may see full approval by the Food and Drug Administration of these vaccines. When that happens, I think federal and state policies will begin to change, and we may begin to see that in some settings, vaccination may be mandated, but we're not at that point yet. And this, since it is a fully voluntary thing, you know, you have to assume that in the group home setting, working with people who we support with IDD, and then also when we're interacting with family members who may be visiting, that you have to assume that you're not operating in a situation where everyone in the room is fully vaccinated. So the left-hand side of this chart would be a good guide to use in terms of judging which activities are riskier than others. Obviously, outdoors is the least risky for everyone. But as you move into indoor settings, then you would want to do some of the things that we've been doing all along in terms of the spacing, limiting the number of people who may be coming in to the home from, because they're visiting someone who lives there, or because they're coming to perform maintenance, whatever the activity might be, to limiting those number of people and limiting the places in the group home where they go. So this can help to guide that. And it's helpful to give people visuals, charts, something they can use to really reinforce the messages that you're sending to them about taking special precautions. Next slide, please. So again, what is the definition of fully vaccinated? It's being 2 weeks past your final shot. So if you were taking the Moderna or the Pfizer vaccine, that would be 2 weeks past your second injection. If it's the Johnson & Johnson vaccine, then it would be 2 weeks after that first dose. Next slide, please. So if someone is exposed in the home, if someone we support is exposed in the home to a suspected or a confirmed case, perhaps there's an outbreak in the home, or someone, comes down with a COVID infection and we know that they've been interacting with someone we support, we do recommend a quarantine for 14 days. Again, this is exposure to a confirmed case. Next slide. But for DSPs, we have kind of a graded approach to this. So if the DSP is not fully vaccinated, then what we're really recommending is testing and exclusion from work for a period of 2 weeks. And that's the same recommendation for DSPs who might be fully vaccinated, but who are showing active symptoms of COVID-19. But if the DSP is fully vaccinated and doesn't show any symptoms, then testing is not a requirement. And again, these are guidelines. You have to make your own decisions within each home about what the protocols are going to be there. But these are suggested protocols for you. Again, for fully vaccinated DSPs who are not showing any symptoms, testing is not recommended and work restriction is not recommended. Next slide. So when residents leave to go home to visit, then you just have to assume that they've been interacting with people who are not vaccinated. And so again, we have kind of these two buckets of recommendations. So let's start with the not fully vaccinated person who we may be supporting, who goes home to visit family members. Then, we would strongly recommend that you consider a quarantine when they come back, because the likelihood is that they've interacted with someone, perhaps many someones who are not vaccinated. And so that would mean, not interacting a lot with other people who are in the home, spending more time in their room, socially distancing, and if they're able to, wearing a mask for a period of time when they come back to the group home. Next slide, please. But if you can guarantee that family members of the person we support are all vaccinated, then those restrictions would not be necessary. Next slide, please. Now, if there's an outbreak in the home, then we kind of have to reset to the stricter protocols that we had in place during the pandemic, kind of before we really had the ability to vaccinate people. So again, we would want to go through a testing process and then a quarantine process for people who are asymptomatic. Next slide, please. And we would certainly recommend testing if there's an outbreak in the group home. Next slide, please. So you may have already put this into place, but I strongly suggested in an earlier training, and again, we've done a series of trainings which are all available on the Primary Care Coalition website. We strongly recommend that for DSPs who maybe have come on board recently, who didn't have an opportunity to participate in the earlier trainings. Those trainings are available, the recordings are available, the slide decks are available. And so we covered topics such as infection control and prevention, the use of personal protective equipment, vaccines, and so all of that information is available to you. In one of the trainings, we talked about putting a protocol in place for visitors. This was when we were just beginning to talk about the reopening process, when visitation was going to be encouraged more. And I think you need to keep the same recommendations in mind that we made earlier, that outdoor is the best place. And especially now that we're in the warm months, there's no reason why visitation can't take place outdoors, and that should be encouraged. If visitation is going to take place indoors, then let's, limit the number of visitors and space people out. It just makes sense. We may be, we'll be having some discussion, I think, later on. I think there's been a question submitted that asks whether visitors should be asked if they have been vaccinated. And yes, you can ask that question, but I think the concern is, are you getting an honest answer from the person you've asked the question to? Because, they're highly motivated to tell you what you want to hear. They would like to be able to spend time with their family members. And so you may not get honest information that you can base your decisions on about what the protocol should be. So it may be a good idea to just assume that every visitor who shows up is unvaccinated, and to screen every visitor who comes with some questions to determine whether they've had exposure recently, or whether they've had a positive test, and have that kind of guide the behavior, and to warn people that you'll be taking them through a screening process when they arrive at the home, and that everyone has to go through that process. They're not being singled out for any reason. Next slide, please. So again, we're encouraging outdoor visitation, but take some precautions if there's indoor visitation. Next slide, please. And these are the suggested screening questions, to ask of each person who comes. Next slide, please. It's also a good idea to encourage hand hygiene, and the best way to encourage it is to provide people with the tools that they can use to do this. Have the hand sanitizer available at the doorway. Encourage people to distance. Remind them that you'd really like them to distance. Ask people to wear masks. And then, again, if the visitors, if you can assure yourself that visitors and the person we support who is receiving the visitor, if everyone's been vaccinated, then you can be less strict about these requirements. Next slide, please. Next slide. But it's important to recognize that things are changing. Right now, they're changing for the better, because these indicators, such as the positivity rate in the background community, is going in the right direction. It's getting lower and lower with each passing day. And the number of vaccinated people in the home is getting higher and higher with each passing day. So the numbers are really going in the direction we'd like them to be going in, but you do still need to monitor, because things could change. We hope that things don't turn around and head in the opposite direction, but that could happen, and you don't want to be surprised by that. Next slide, please. So again, when someone comes back, when an unvaccinated person who we support comes back from a visit, we recommend testing. Next slide, please. And it would be a good idea to, again, before people leave to go home for a visit, to have a discussion about what safe practices could be they could be taking for themselves while they're conducting the visit at home. And to reinforce those messages each time someone leaves to go home for a prolonged visit. Next slide, please. So again, the next few slides are reinforcing this message that there are kind of two buckets. And I think for the most part, you're going to be in the second bucket, which is the bucket where you have a mixed group of people in the home. So some DSPs who are fully vaccinated, some who are partially vaccinated, some who are unvaccinated, and some people who we support who are fully vaccinated, some who are unvaccinated, and some who are partly vaccinated. And so we need to, I would assume that for most of you, you're going to have to continue with these precautions because of that proportion of people who we're working with who are not fully vaccinated. So continuing to socially distance, continuing to wear masks, etc. Next slide, please. And again, this is, we're working towards this goal of everyone being fully vaccinated. This is a goal we may never reach. Next slide, please. So take special precautions for group activities because, group activities are coming back. I think we've all been through a long drought of not having the ability to interact with people in the way that we would like to interact. And we're social creatures. We thrive on that interaction, but we need to continue to maintain some precautions for indoor activities where we're interacting with people who are not fully vaccinated. Next slide. And so this slide really just underscores those messages I've been repeating over and over again. Next slide. Next slide, please. So I would like to say just a few words about PPE. In the beginning of the pandemic, there were some real concerns and a limited ability to access PPE, some shortages. And so we really were trying to stretch a limited supply. That's no longer the situation. And so you really do not need to still have protocols in place that encouraged reuse of PPE. PPE is no longer in short supply as it was before. Next slide, please. If you would like to, I did mention that the PPE training session is still available on the Primary Care Coalition website, and so you can still make that available to new staff so that they can receive the proper training on how to use PPE, and that's always important. And I think it will be important moving forward. Even 6 months, a year from now, when COVID starts to fade into the background of our memories, we are still going to need to be clear and have people well-trained and conducting themselves in a manner that minimizes their exposure to infectious agents. And PPE is a critical part of that. Next slide, please. The testing that was put into place, some centers were conducting weekly testing, some doing it a bit less frequently. The regular testing surveillance activities have been curtailed in some of the group homes, in part recognizing that infections are just not circulating as easily as they once were. And also testing has been made pretty readily available at the county level, by some of the state facilities. So the need to test in the group homes seems to be waning. That of course could change if there was an outbreak. If there was an outbreak, you would certainly want to revisit this regular testing, but for right now, it does seem that the regular testing and surveillance in the group homes is not as necessary as it once was. Next slide, please. The big question mark, I think, for all of us is, will we need more vaccines even if we've been vaccinated? And I think that's an open question right now, but it's a question that will probably be answered within the next few months. Some of the major pharmaceutical companies are, are looking to develop boosters. And this is not an unusual circumstance for infectious disease where you develop a vaccine and then there's a time period when immunity is good, but as time goes on, the immunity starts to fade, and a booster shot can bring that back up. It's true of tetanus. It's true of a lot of things. It is probably also true of COVID-19. And we may need booster shots in the future to make sure that our immunity stays strong. Next slide. So I'm going to turn it over to my colleague, Sydney Robinson, and she's going to talk to you about the travel restrictions.
Awesome. Thank you, Dr. Phoenix. And now we're going to switch over, as you mentioned, to discuss a little bit about travel. I know many of you are probably anxious to spend some more time with your family, whether that's locally or maybe internationally, but regardless, there still are some recommendations in place as to how to stay safe, whether you are fully vaccinated or not. And so as it relates to domestic travel, if you are fully vaccinated, the important thing is that you still do self-monitor yourself for any symptoms you might be experiencing, and also wear a mask. And for those that are not vaccinated, it's important that testing is also looped into that self-monitoring of symptoms and wearing a mask. Now, for international travel, however, it's required that anyone returning from an international flight is required to have a mandatory test before returning to the United States. And so when you're planning your travel, it's going to be super important that you have a plan before you arrive abroad to be able to make that happen, so that when you do return, you don't have any difficulties getting back to your home following travel. And again, those same practices should be in place along with the mandatory test of wearing your mask, monitoring for symptoms, and of course, some other safe practices include limiting contact with people that aren't from your household, and avoid unvaccinated people or not fully vaccinated people. Again, we are kind of operating on this honor system, whereas in the public, you don't necessarily know what group you may be around. So in order to keep yourself safe, again, distancing is key. If you're going to travel by car, make fewer stops. And if you're flying, again, taking a direct flight is safer. And some other tips, especially for those that may be traveling for young children, we're seeing now that the virus is kind of shifting into that younger population, as some of those groups are not able to be vaccinated just yet. And so it's important, especially for families. Avoid close contact with people who aren't from your household. Again, thinking about shorter trips that require less stops and avoiding flights with layovers as well. And now this will be a little short video that'll give you some quick tips from the CDC about knowing your risk and reiterating those safe tips I just spoke about. So it's going to be key. A way that they put it is that when you see more faces, or when you see more faces in indoor spaces or linger in places for a longer period of time, it's important that you reduce your risk by avoiding crowds in those indoor spaces, limiting close contact from people who you don't live with. And as Dr. Phoenix has stressed throughout this presentation, choosing outdoor spaces and social distancing, even when outside, is still safer. All right. So now to speak a little bit about public transportation or transportation in personal vehicles or vehicles such as Uber or other quick ride services such as Lyft. So as far as it relates to transportation in personal vehicles, again, avoid those crowded spaces, limit the number of passengers in the vehicle as much as you can, and improve the ventilation in the vehicle if possible. And what that means is opening the windows and setting that air ventilation or air conditioning on the non-recirculation mode. And also, if using a rental car, doing those same practices, as well as sanitizing door handles, steering wheels, or those commonly touched surfaces. Whereas, if someone's switching to the driver switching shifts, there's going to be someone else in the driver's seat. All those practices are super important as far as infection control goes. And transportation and using a group home vehicle. We know some of the group homes may have personal vehicles that they utilize for the individuals that they serve. And so in those vehicles, for those that can tolerate the mask is still recommended. And again, same practices, increasing ventilation when possible and social distancing within the vehicle. Limiting contact with the driver, as I mentioned, sometimes the driver may be different in the daytime and different in the evening. And that may be someone that you have less close contact with, as you don't know what their vaccination status may be, or if they work for another setting. So again, try to keep the distance as much as you can, avoid touching surfaces. And then when you arrive at your destination, kind of assess your surroundings. Is there an easy place for you to wash your hands or use an alcohol-based hand sanitizer when you arrive? And finally, in Montgomery County, as well as the CDC recommendations, still recommended that whether or not you're vaccinated or unvaccinated, that face coverings or masks are still required on public transportation. And some local examples that you all may be familiar with in Montgomery County, that would include the county ride-on buses, the Metro bus or Metro rail, even taxis, and the on-demand car services, as I mentioned, such as Lyft or Uber. And all in Montgomery County Department of Transportation buses do have face coverings or masks for those who may arrive to the bus and not have their own. And we're expecting, and the county has recommended that from what they know so far, this will be a recommendation that will stay in place until the fall. So keep an eye on any changes related to that. So again, finally, social distancing on public transportation is recommended along with the mask. And the bus interiors are doing a really good job at keeping them clean twice daily, as well as the ventilation systems and air filters within the transportation systems have really been upgraded in order to accommodate and reduce that spread of COVID if it is present. All right. Thank you so much. We hope that this information has been valuable to you. We will now take any questions you have relevant to the content we've covered today.
Feel free to either raise your hand or put your question in the chat if you have any questions for Dr. Phoenix and Sydney based on the content. All right, I don't think I'm seeing any hands raised or any questions in the chat. And feel free to take yourself off mute as well if you'd like to ask a question. But as we mentioned, this information is going to be posted on the PCC website. And the slides as well will be available with updated information. So you'll be able to review that.
We could also use this opportunity. There are 2 additional resources from Johns Hopkins and some of the information that Dr. Phoenix wanted to share. We could take that time if there aren't any questions.
Sure. So I see some questions popping up. First one is, can you please go over guidelines for international flights?
All right, so for international travel, again, for anyone returning, whether vaccinated or not, a mandatory test is required before flying to the United States. And so, a lot of international sites have set up ways at certain hotels, whereas you can plan ahead of time to make sure you do have that test done before you do arrive back at your destination in the United States. Regardless, masks are recommended, as well as social distancing and continuing to monitor for any symptoms.
There was a question about the Delta variant. The Delta variant is the newest variant, and it emerged from India. I think the understanding is that that because there were so many people in India who were unvaccinated, and because the number of cases increased so rapidly, it became really the perfect breeding ground for a new variant to emerge. And that variant has been detected in other parts of the world now. And although we have not seen widespread detection of that variant here in the US. They've been testing the effectiveness of the current vaccines, the Moderna, the Pfizer, against the new variant, and they are not as protective as they are against the original strains, but they do offer some protection, which is the good news. And I think here in the US, because we have fewer people, a much smaller number of people who are unvaccinated, there just isn't the ability for even the newer strains to circulate in quite the same way that they might circulate if if we had a larger unvaccinated population. So again, the B.1.617 is the numerical designation of the latest variant. This is a resource that will be available to you in the slides that will be shared in a couple of days, that will be posted to the primary care website. And I would encourage you to use this resource. Johns Hopkins has been a great place to go to get the latest information about what's happening with COVID-19. And so they've actually set up a phone application that you can download, and the link to get to that will be in the slides that will be shared with you.
Thanks, Dr. Phoenix. I see another question about, has there been any guidance on inquiring about vaccine status for consumers or individuals receiving services?
So I think the legal guidance, and there was an opportunity to have a fairly good discussion about the legal framework for asking that question in group home settings. The guidance is that that you really can't require people to disclose that information, for a lot of reasons, because it could lead to potential discrimination, especially for DSPs. But there also need to be protections in place for the people we serve in terms of their confidentiality, and minimizing the potential for them to be discriminated against. So people can voluntarily disclose the information, but it can't be required that people disclose the information. That's my understanding of the take-home messages from the collaborative meeting that focused on the legal framework.
And Stacey, I think there was a webinar that was done a few weeks ago by Cheryl Brown, who's an HR attorney, and she covered a lot of that in depth. So I can go ahead and send you that link where you can access that that webinar.
Thank you.
Another question, is it necessary for PPE to be reused now? Should group homes require visitors to disclose vaccination status? Okay, I think we touched on that. So I guess the question is it necessary for PPE to be reused now?
It is not necessary for PPE to be reused now. Supplies are adequate, and so we're not in that kind of emergency situation that we were in several months ago when there were shortages. So the answer to that question is no. And again, another question about employees. Employees have rights, and cannot be mandated to receive the vaccine currently. And so the question that was in the chat about firing someone if they don't disclose their vaccine status, that can't happen.
I think it's also based on the last training, it can be nuanced based on the reasons and the accommodations made based on why an individual or a DSP or a worker is refusing to be vaccinated. Are there any other questions? I think I see questions. Since this is the last webinar, what resources will be available to address questions that will come up as new information becomes available? You can always reach out to us, but I think the CDC and sort of the Hopkins websites are great resources. Dr. Phoenix, do you have any other good resources that folks can use as sort of a go-to for the most current and up-to-date information?
So the Centers for Disease Control Foundation teamed up to create a site where messaging material is available, kind of material you can use to educate others who you work with or who you serve. So there's a site called the Public Health Collaborative. We've included a link to that website in the notes for this presentation. So if you download the slide deck, you'll be able to access the link to that website. It's a great resource in terms of finding short videos, infographics, a lot of tools that you can use that are current. They're updating that site daily with information. So I would recommend that as an additional place to go to get material that you can use to educate others. Things you can put up on a bulletin board or that you can send to people via a link, or that you can, print out and put up posters you can put up on the refrigerator or in common areas, so that people can be reminded of the things that they need to be doing to keep everyone safe.
Thank you. I see Sydney has put in the chat the website for, I think it's www.publichealthcollaborative.org.
Yes,
So you might
and as I
wanna,
said, the Centers for Disease Control Foundation is one of the contributors to this site. And so it's good information, it's accurate information, it's up-to-date information, and it's pleasing in its presentation.
great, thank you. All right, any other questions? Okay, it doesn't seem like we have any other questions. So with that, we will wrap up this session. Thank you everyone for joining. If you have any questions that come to mind, feel free to shoot us a message. We'll be happy to, you should have received the invite from Jessica. So if you wanna use that email address and send us a message, we'd be happy to follow up with you, and then I will be happy to post this recording and the information, the slides on the PCC website, so you can review this. So with that, we will close our session for today. Thank you, Dr. Phoenix and Sydney, for walking us through, and everyone have a great rest of your week. Thank you.
Thank you.
Thank you all.
Thank you.
Thank you.